All right, we are on. Welcome, everybody, to this week's episode of Weekly Dose with Dr. Uday. I am Dr. Uday, and I have an amazing special guest today. I have Dr. Kelly Elmore, and we are going to be talking about vaginal pain and delving in and getting some information on that. So, before we get started, I'm going to start with introductions, and then we're going to get right to it. So, like I said, my name is Dr. Uday. I am a board certified family medicine physician. I'm based in Martinsburg, West Virginia. I co-own a primary care practice, namely Apple Valley Family Medicine, and I also provide aesthetic services to my clients. With both modalities, my goal is to have my patients not only feeling good, but looking good. So I'm going to get right into with Dr. Elmore. So a little bit about Dr. Elmore. She's a board certified OB-GYN. She completed her medical degree at University of Chicago School of Medicine on a full scholarship and residency in San Diego, California. She also holds a master's degree in business. She is a high energy, dynamic speaker, and her life's motto is to educate, encourage, inspire men, women, and youth to Viva Life, starting with their health.
Yep.
So, go ahead.
Thank you so much for the introduction, Dr. Uday. Thank you for having me here with your network and your clients and your friends and colleagues, I'm sure. So thank you. As you said, Dr. Kelly OMD, board certified OBGYN and healthcare executive, trying to make sure that we have increased access to care and highly valuable education that we need so that we walk into our appointments with evidence-based understanding of what's going on with our bodies.
Yes, well needed. So excited. All right, so let's get right to it. So the topic is vaginal pain. So from your perspective, Doc, what is it?
So you know what, when I think about vaginal pain, I think about, what is the entire system that is involved with this vaginal pain. So for me, I tell people, you know what, I operate from here to here. So that's the belly button to the top of the hips, right? But when we think about it, we think about, we don't want to just survive this pain. We want to thrive and overcome the challenges and the barriers that are associated with this pain. So when we think about chronic pain or vaginal pain, we think about pain symptoms that are lasting longer than 6 months, and it can be associated with our organs. So when we think about me as a GYN, when we think about that area, we think about our uterus, our vagina, our clitoris, our vulva, which are the lips. We think about the ovaries, the fallopian tubes, sometimes the appendix, and many times the bowel as well. So those are, that is the area we're going to focus on. But what can happen is, because of this pain being pregnant, we can have effects from head to toe. So we think about, what's going on mentally, spiritually, as well as the physical and emotional part. It can cause us to have sexual concerns. So trying to have intercourse, we're not able to have intercourse because we're having pain or afraid of pain. And then there can be musculoskeletal and neurological issues that are associated with it as well.
Gotcha. So lots of causes there from what you're saying. So the other question I'll have for you is, how common is it? How common do you get that complaint?
The complaint quite common. And from a primary care perspective, you're probably the best person to say, okay, what's the percentage of people that are coming to me? Because when you get to me as an OBGYN, unless I'm your primary care doctor, you have already selected out patients for me to see. So, chronic pain is something that's pretty prevalent. So I would say about 20 to 30% of my patients have some sort of chronic pain. And it could be a little bit higher. And as we delve into things, then we find out, even if your pain is a 1 to 2 versus an 8 to 10, I have to be able to delineate that out and be able to understand, how is this 1 to 2 affecting your life versus this 8 to 10? And is this a chronic issue, or is it an acute issue? Meaning like something that is a quick onset, it kind of goes away within a couple of weeks or a month, or is this something that's been here for 6 months or longer in your life?
Gotcha. And who gets it? Like what age range or type of patient do you see with this issue?
So it could be anyone. All right. So it depends on what the source is. So we talk about chronic pain can be from many sources. So it can be your gynecological organs, like we just talked about, the ovaries, the uterus, the tubes, the vagina. It can also be your gastrointestinal organs. So is it your appendix? Is it your bowels? Is it a musculoskeletal thing? Is it your actual pelvic floor? So your pelvis is a bowl made up of muscles and ligaments. Is it that? Is it your back? Is it your hip? Is it your thigh? So it could be any of those things. But women tend to have more chronic pain concerns, issues, and diagnoses than men do.
Gotcha. Now, how do you diagnose it?
So the basics, we got to go back to the basics. When we talk about diagnosis, it always starts with a great history. And one of the things is we are not going to get through this discovery and defining and evaluation of your chronic pain in one visit. Why? Because most visits are 20 minutes, and a 20-minute visit is not going to get it all in for us. So number one, we recommend having a longer visit. So your initial visit, if possible, could be 30, 40 minutes, sometimes an hour. And we may have to do that visit over 2 to 3 different visits. We also like what's called a pre-screening or a screening tool that we use associated with asking questions about your pelvic pain. So in that history, we're asking you, the when, what, where, why, and how. When did this start? How often does it come? Do you notice it associated with anything? How long does it last? What makes it feel better? What makes it feel worse? And what have you done in regards to treatment for it in the past? And what are you currently doing? So those are some of the basic questions that we ask in the history. And as a GYN, I'm going to go through the history, like really a head to toe history, not as significant as yours as a family medicine, but I am going to go through kind of a head to toe. Okay, let's think about this by systems as well. From there, we're going to do a physical exam. So I'm going to ask you where that pain is. I'm going to ask you to try to locate it for me. And then I am going to examine your body, typically from the chest down. Of course, if you haven't had all of your primary care, preventive care, I'm going to work with my medicine doctor and get that done for you too. Making sure you're whatever age you are, the preventive health care is very important. So we're going to make sure that we do an exam from your kind of breastplate down. And we're going to start externally. We're going to go slow. And we're going to explain what we're doing as we do it. And then we're going to go internally. We're going to feel for it. We're going to look, we're going to listen, and we are going to feel. And that means I need to be able to feel those internal organs. If you still have a uterus, your ovaries, a lot of times we can't feel the fallopian tubes, but we feel that area. We also look at your vagina. We look at the inside of the vagina. We actually do testing on the outside of the vagina or vaginal area, if that's where you're feeling your pain. And then we decide whether or not we need to do any more modalities. Some of those modalities could be any laboratory tests. Typically, laboratory tests are not going to address chronic pain, but if you're having an acute pain syndrome, some laboratory tests, like if I need to rule out appendicitis, or, your liver feels enlarged, or, something like that. But laboratory tests or if you're having urinary tract symptoms, that could be something we need to do a urine on, as well as radiology. Typically, I only do radiology tests if I feel for something that's abnormal, or I'm noticing something in your history that will require you to do a radiology test. And then that's where like the basic appointments, those first 1 to 3 appointments, that's what those first 1 to 3 appointments are. Before we actually get into any procedures, surgery, medication, or anything like that, we really need to get a great understanding.
Absolutely. And that was a really, really great answer, because with the like just how comprehensive your explanation, that really explains why you have to spread out those visits to make sure you're able to get to everything. Now, treatment, I know there are different causes that you mentioned, but just, a little bit on possible treatments for
Right.
this.
So treatment. So if we're talking about gastrointestinal, I'm going to leave that to my cousin who is a gastroenterologist, right? So do we need to look down do an endoscopy? So do we need to look down and look and see if there's something going on with your gastrointestinal system? Urology, we already mentioned, really the first thing with urology is figuring out, people's urinary patterns, because bladder pain is actually very common in the pelvic pain array of syndromes, right? So looking to see, okay, let's get a urine dip, or let's get a urine evaluation analysis is what we call that, and see, do we have infection there? Do we have extra white blood cells? Do we have extra red blood cells? Is there something like that that's going on? From a GYN perspective, when I think about treatment, and because I am a very natural OBGYN, I try to do everything possible on a natural basis before we start getting into medications and surgery or procedures. Then I am going to look into, okay, do we need to do some type of pelvic floor physical therapy? This is a very specialized type of physical therapy. It is very important in a woman's life that she knows about it and utilizes it as she needs to as she matures. So pelvic floor physical therapy. Do we need to do regular physical therapy or exercise physical therapy? I am a huge, huge, huge believer in our physical therapists. I am a huge believer in Pilates, yoga, as well as our cardiovascular exercises that we do. And that being said, we need to be very careful about when we start lifting weights and
Mm.
being involved in high intensity exercises. We need to make sure that we are with a trained professional when we're starting or doing those things, because we can actually throw our body out of alignment, all right, and doing that. And then also when we're doing these, I told you about, sometimes if you're having some bladder pains, we do have the ability to do basic bladder workups as well. And that may mean I need to learn about, what is your urination night? Are you having burning with urination? Are you not able to hold your urination in? Does your pelvic exam, when I'm taking a look at your vagina and your organs, does it look like your organs are starting to come out? So is your vagina, is your uterus or cervix starting to fall and you're getting, what we call pelvic organ prolapse? Could that be the cause of you having pelvic pain or vaginal pain? We also do something called a Q-tip test. When I place a Q-tip on your lips, your labia, or your clitoris, or at your vagina, are you having sensitivities and pain with that? When I place my fingers inside your vagina, especially when I'm feeling the backside of it, am I feeling any type of pain that's associated with that? And is there something we can do about that? Sometimes we can do what's called trigger points injections, where we're placing sometimes it's just normal saline and sometimes it's steroids in an area to help with that muscular myofascial pain, which is, that muscle and that covering over the muscle pain. Do I need to do a Botox treatment for you so that we can help with that pain? And then acupuncture and chiropractor, I truly believe in them. I use them myself as treatment modalities to help with my pain. And then the other thing we talk about is medications. We do not recommend opioids, which are, your narcotics, for chronic pain management. If that is recommended, it's recommended by my pain specialist. Opioids cover up pain. They do not treat pain. They may help you in an acute situation, but chronic pain, it is not treated by that. So we recommend that you see a pain specialist for that if that's something that you need to go down that path of. But there's other options that we are associated with. So like antidepressants. Antidepressants can, yes, be used for the cognitive or mental health concerns. But then also these same antidepressants have ability to help with our pelvic pain, chronic pain syndromes. The other medication you may hear about is a medication called gabapentin. That's another medication that helps address kind of neurological or neuropathic pain. So we use that as well. And then lastly, we go back to talk about those procedures, right? So those procedures, anything when I'm sticking a needle in or sticking a camera in somewhere, procedure. Surgery, we try to focus surgery on actually finding abnormalities. So if I find an enlarged ovary, if I find fibroids, which are large tumors in your uterus, if I find that you have maybe a fibroid that's coming out your cervix, then I'm going to utilize a surgical procedure to do that. So that's laparoscopy or hysteroscopy. I try not to go in and do laparoscopies on patients that I have found nothing on, okay? But if I've gone through my whole differential diagnosis, I've given you all the other treatment modalities and I can't find anything else and you're still in pain, then I may put a camera in your belly to see if there is something called endometriosis there, which is that's another conversation. That's a whole nother topic. But endometriosis, we should think about that. Adenomyosis, think about that. And then scar tissue. So if you've ever had an undiagnosed pelvic inflammatory disease, so like an STD, gonorrhea, chlamydia, or appendicitis, then you could potentially have scar tissue that could be causing you to have pain.
That is amazing. So that was a really, really good synopsis of possibilities on what treatments you have. So you guys heard it. You thought it was going to be good. You just didn't know it was going to be this good. All right. So Doc, we're going to switch gears. Just a couple questions about you.
Yes.
So I ask my doctors that come on, why do you do what you do?
Well, I absolutely, first of all, I love it, right? That's the biggest thing. You got to love it. You got to be passionate about it, because if you don't, those late nights, early mornings, especially OBGYN, most of us start as OBGYN. So there's late nights, early mornings, weekends, and all that. You got to be passionate about it. I also have a passion for advocacy for women. And I say that I was called to the pulpit of women's health. And the reason why is because it popped into my head. It's something that really popped in my head. Now, as I've done my shadow work, my trauma trigger work that I've had to do over the years, I realized, because I, as a young child, was exposed to women's abuse, sexual, physical, emotional abuse. And I also realized that their physician or their OBGYN or their family medicine practitioner may have been the only person that they could really talk to in a private situation to start addressing these issues. So, first of all, I love it. I was called to the pulpit of women's health. I am an advocate, a very strong advocate of access, evidence-based, educational, culturally sensitive, safe, and quality care. And I'm going to make sure that that continues to perpetuate in our communities.
That is a powerful reason to do it. Thank you so much for doing that. It's well needed. Other question. So, with all the experience and life that you've lived so far, if you got a chance to meet your 20-year-old self, excuse me, if you got a chance to meet your 20-year-old self, what would you tell him?
Well, I would tell my 20-year-old self, number one, girl, you did it and you doing it. So all the times that we're thinking, I'm not enough, it's too hard, no, you are going to make it. So, there's two things in my head at all times. I can do all things through Christ who strengthens me, right? And all things are going to come together for our good. And those are certain things I learned when I was a little girl. When you learn in Kiwanis, all the Bible verses and things like that, those are kind of the ones that stuck with me. And be ye anxious for nothing.
I love it. I love it.
That's what I would
tell. You hearing that response, I just want to say period. That's it. I love it. I love it. So Doc, we are wrapping up. So where can people find you, connect with you if they're looking for you?
Thank you very much for asking that question. So first of all, I tell everybody, just Google me. But Dr. Kelly OMD, DrKellyOMD.com. I'm also on Instagram at Dr. Kelly OMD, as well as drkellyomd.com for my website. And lastly, if you really want to follow a lot of the educational teaching, Viva Life Health Hub. Viva Life Health Hub.
Awesome. Awesome. Thank you so much. I mean, my patients are so glad that we did this. And there's going to be a lot of people that are going to be helped with this. On the flip side, guys, if you are looking for a primary care doctor, we are available to help you at Apple Valley Family Medicine. Give us a call at 304-350-1087, and you can find us online at www.applevalleyfamilymed.com. This was amazing. We are all done. Thank you so much, Dr. Elmore. Thank you, thank you, thank you. Have a wonderful week, guys. Bye.